Yep.
Good afternoon, everybody. I'd like to welcome everyone to the Virginia Transit Association's webinar, COVID-19 Pandemic Impacts on Public Transit Agencies. I'm Lisa Guthrie, Executive Director of the Virginia Transit Association, and we are glad that you can participate from wherever you're working during this time of social distancing. And this is going to primarily be an open-ended forum for you all to come together, share some of your experiences, and learn from each other. We're recording the webinar, and it will be available on our website. We also have on our website some other information about COVID impacts from DRPT, from APTA, and from other associations like Southwest Transit Association. So more detailed information can be found as you need it. So joining us today is Polly Hansen, Senior Director of Security, Risk, and Emergency Management at APTA. APTA is the leading force in advancing public transportation in North America. And to strengthen and improve public transportation, Ms. Hansen coordinates with stakeholders to develop transit security risk and emergency management standards and policies. She performs peer reviews and assists with safety audits and serves as an advocate for transportation security, as well as a source matter expert on transit security, risk, emergency management issues, and concerns. So, Polly, welcome, and please share with us anything else you'd like for us to know about what you're doing right now with the impacts of COVID and working with APTA in that regard.
Well, first I want to say that I'm standing at attention because I am wanting to display my respect for everybody and what they've been doing during these very challenging times. And if you're looking at the screen, I look just like my picture because I got that dressed up to telework. And once again, out of respect for you, Lisa, and the folks who are on the line. So you'll see from my background that I was a policewoman for 40 years. So my background is really in kind of the preparation for emergencies and disasters, the response. And, one of the interesting things, and maybe we'll bring this up later, is the recovery from the restoration of service. So, going to some of the topics that are on the agenda today, which are emergency plans. Certainly, if you didn't have one, you probably have one now. And we know at APTA from the various webinars that we've had town hall meetings with CEOs, we've had webinars with safety representatives, the chief safety officers, bus operations. We had it was really more of a conversation like we're going to have here last week. And, we know that people their maturity level on the spectrum is different. And some of that comes from how much have you been affected? Certainly we know that Seattle is outliers. And so a lot of folks looked at what they were doing. Now people are looking at New York, and certainly in Louisiana as well. So this is very different and interesting. Many of the disasters or emergencies that I've responded to, other than a riot, which are ongoing and continuous, you have a tsunami or a tornado or an earthquake, or even I've been on some really horrific derailments, and you have the event and then what you do afterwards. And because this is changing every day. In fact, I heard somebody over the weekend say, a day feels like a week and a week feels like a month. And then it's not uncommon now that people don't know what day of the week it is and how much, the difference that 2 weeks have made. So, going back once again to the emergency plan, if you didn't have one, I would suspect that you certainly do now. If you don't, we do have a number of resources. The Transportation Research Board, because of who they are and what they do, and APTA works very close. We're panelists on the topics that pertain to our fields of expertise. They have a very robust document on how to create a plan and also how to do communications with your public and how to do continuity of operations. And APTA has a smaller document that's a recommended practice on how to develop a plan. So if you think you just want to hit your plan up against other plans or just look for other resources, you certainly could go to the apta.com, the resource page. You can't miss that picture we've all, gotten really used to of what the virus looks like. You hit that, There are many sections, things internally. A lot of agencies have shared their best practices. One of the early best practices we got was from San Diego, and it was a YouTube of their folks doing a deep clean. And I think that their media relations PIO was probably brilliant, and people were probably continuously asking them, what do you do? And so they, had their own camera guy go out with a cleaner and showed what they did. Other examples, for instance, of the signage for if you're going to board the rear door, and looking up our notes from the call last week with bus operations, it seems now that that's the most common practice, is that folks are having customers board a bus from the rear door to minimize the proximity to the operator and create opportunities for social distancing. But once again, APTA has a really fabulous resource page. If you wanted to look at your emergency plan, you could look at both the APTA recommended practice on how to develop a plan, and then the TRB, how to develop a plan. Communications with the government and the public, this is what you folks do every day. I think the most distressing communication that you hear about is when people announce that they've had an employee that tested positive for COVID-19, and I can talk a little bit about that, and how you tell your employees, which of course is hugely important. The communication with employees, interestingly enough, and some of the things that I'll share just because they've been said in a common conversation like this. WMATA's Joe Leader said, and if there's anybody from WMATA, I did spend 27 years there, and it's not for that reason, but WMATA's done a spectacular job, and they merely, going back to plans, brushed off their pandemic flu plan from 15 years ago, which when this is all over and they do an after action will be very different. But that was the guidebook that they were using, and it's, served them well as a framework. Certainly not everything was in there that they needed, but they were nimble enough to be able to adapt. And I think when we talk about social distancing, that's something that people are having to do, adapt and be nimble on a regular basis. But I do think the conversation with both the public and then your employees, particularly when somebody tests positive, is really important. Some people have said, oh, no, it wouldn't be their responsibility to speak about a positive tested COVID-19 person. And there I would say you need to be guided by your local health officials' instructions. And if you've not, or you don't know who your local health official is, you do want to find out who that person is now, because you don't want to wait until you have a positive test. And quite honestly, we've heard a variety of things. I've been on the safety calls, the security folks, we have regular conversations. Some jurisdiction, the local health professionals are going to be very closed-lipped. They're not going to tell the transit agency who the employee is. That makes it really difficult for you then to go have conversations with employees and do some of the community contact conversations that have to happen so that you can determine who else was exposed. In the case of WMATA, their first positive COVID-19 was a cop. And so the CDC actually assisted WMATA, from what I was told by the chief, had conversations with employees. Initially, they thought it was a much broader audience of people that had had contact and would have been impacted. And then based on the conversations with the health officials, there were a number of people who were determined to be in a position where they would need to self-isolate. And of course, one of the things we don't talk about here is certainly with the recent legislation that passed, there is guidance there depending on the size of your organization on what you have to do for employees with sick leave. And I know that many people were on a call recently with APTA's government relations folks, and I know that they're putting together a list of frequently asked questions, which is something else that's on APTA's website. The questions that people ask us, and we have an email address for that, we do then capture or package thematically so you could go through, because a lot of people are asking the same questions. Certainly, the operators and employees, and I'm so glad you put operators first, because in my life, in my career, I always said if I had to take care of the operators and employees first before I could take care of our customers. But one of the things that WMATA noted is, and this is public because you saw this in the paper, they were having some conflict with their union, and because of their strong communications, now they were really able to do the things that were best for everybody, the customers, and their employees in the organization, because they had really great, strong communication with the operators, the employees, and their union leadership to get to where everybody felt really safe. And you'll see, because they publicize it, they don't hesitate to close down a station or an area. There was a service disruption yesterday because they had concerns and wanted to go investigate. And then I think over the weekend, there were stations that were closed because a contractor had tested positive, and they went in there and cleaned up. And so the whole, issue of social distancing, this is one that is really fluid. I noted that I saw an article today from New Jersey, and they did some service reductions, and they did them on a route then that, because of the schedule they went to, had people not following the recommended practices, and people were alarmed, disturbed, and very upset. And so what New Jersey Transit said that they would do was, on the other routes, they hadn't seen that. There was enough room on buses that people could spread out. And in this case, they said they would look at that particular bus route, and if necessary, they would increase the service there so that they weren't causing people to violate what we now know are the 6 feet, and not be as close to people. So I do think that agencies are really trying to balance reducing service because we're all supposed to be staying home, except for essential employees. And I will tell you, LA Metro just put out a video today, going back to number 2, communicating with people, that highlights their employees first. I'm a hard-hearted Hannah, and I'm going to get teary-eyed here. It is the most lovely little media piece that they put together to say, hey, you know what, you're really supposed to be staying home unless you're this essential, wonderful group of people. And they list like anybody you could think of, the orderly in the hospital, the guy that's bringing you your carry-out food. They show their conveyances, and there's largely nobody on them, but they do show the nurse getting on board, and they talk about, we're here for you, even though, whether you're staying home or you're an essential person and have to go to work, we're here for you. And then they end by showing the pictures of their wonderful, employees who now the federal government realizes are first responders. APTA worked with the federal government, DHS, and an organization that really usually does cyber infrastructure security, CISA, but they've been coordinating with the critical infrastructure. And so if you're not aware, transportation, mass transit has been designated as critical infrastructure, and mass transit workers, and there is language that was inserted. Whoever was on a late Friday night neglected to include the word contractor, but will include contractors. But our transportation sector has been deemed critical infrastructure, and our employees essential. And this has really helped in states, and it's not so much an issue for mass transit. It is for, say, a trucker or over-the-road bus that are going from one state to another, that it does allow you the freedom of movement that you need for commerce and moving of services. And, of course, in our case, we're moving people. But it's really fabulous to know that DHS has recognized both what we do as critical and our employees as essential. So, I'm just going to skip down now to 5, and the disinfectant protocols and products. There are frequently asked questions on our website. The chemicals, you can go on the EPA website, and a lot of people are doing foaming and some other techniques. If you have a particular question, you could certainly just go ahead and email me, and it's phanson, HANSON, @apta.com, and I'll get you an answer. I don't profess to be an expert in any of this, I've, certainly been doing a lot of conversations and making sure that I'm on all the calls. But I can tell you that we do have information about protocols and products, and if you have a particular interest about a particular type of vehicle. I know we had a call, I think now a week and a half ago, with paratransit operators. Totally different conversation because of who you're carrying and where you're going. We actually had folks from Toronto, TTC, because they were really out in front of SARS when it happened. And so they had already developed protocols for both their employees who then are moving, people who are immune compromised or already at risk, many times to hospitals or to other care facilities. And so there are some special protocols they put in place. And if those were things that interested you, please, let me know. phanson@apta.com. And what we know is that everybody really has reduced service. And going back to the conversation that I mentioned about New Jersey Transit, they got hammered today in the media. They'll make an adjustment. They didn't know that, that was going to cause this. And you've seen a lot of transit agencies modify their service so that people can spread out. Certainly, the service equity, if you have questions about those issues, we send those to our attorney, Linda Ford, who many of you may know. Linda was FTA's attorney. So she's spot on. And in the frequently asked questions section that I identified, there are questions about denying people service. Because of a variety of factors. They tell you they're going to the hospital because they just tested positive. So she has guidance there about refusing service. And of course, many people now, because of the boarding the rear door, are allowing people to travel for free. Some of the free movement now across the country has had transit experiencing an increase in homeless folks using the conveyances, and that's for several reasons. Some of the jurisdictions where you're not supposed to leave your place, homeless people were told, if you're in the shelter, you need to stay here, so you had some folks leave. Some homeless facilities across the country, because of social distancing, are not as accepting as many people. So many transit agencies across the nation have seen an increase in homeless who on a regular day value mass transit because, much like a library, mass transit is perceived to be safe and a refuge and a place to get out of the elements. And a lot of the people who are having those problems, once again, are trying to partner with social services, which people do on a good day, and to see if they can't get the homeless people in a better environment than the transit environment. Going back to one of the wonderful things that agencies are doing, my old boss at APTA, Randy Clark, who's now CEO in Austin, they actually were using vehicles. They were getting so many calls for paratransit to take people to the grocery store that they reverse engineered that and started working with food banks to take food out to the folks that needed it instead of transporting them to the food. And we've heard that from other agencies. And once again, Linda Ford does provide guidance about if you're going to use your vehicles for something other than what FTA is, giving you the money for or the guidance for. So look at the frequently asked questions. And then once again, if you have a question and you go on the APTA site, you'll see where the, coronavirus, at apta.com, you can ask us, questions, or you can send them in to me and I'll get you an answer. The FTA requirements and emergency relief, really the best thing there is to reach out to FTA. And, it's always really interesting to me how popular you are when you have money. And, of course, FTA does have several websites, and their email address ftaresponse@dot.gov, and that's where people are sending in the requests for guidance or relief, and as well as the docket. So I know a lot of people were concerned about PTASP, and folks would like to see some relief on the July 2020 requirement for the public safety regulation. I think APTA is accumulating or compiling people's concerns and will weigh in. But the FTA response at dot.gov is a good place to get any kind of questions you might have answered. And I do believe that they were supposed to, FTA said that they were on track to meet the April 3rd deadline for getting the $25 billion in CARES Act funding to the urban and rural areas. And I do know, or I'm led to believe, that the acting administrator, K. Jane Williams, has been in contact with folks. But once again, if you had questions or concerns, the FTA response at dot.gov would be the best resource for those. And once again, you have something for APTA, you could just email me at thanson. So I think we talked about emergency plans. If you want to, compare yours against some other ones or some other guidance, the TRB document and APTA's recommended practice would be good places to do that. Very similarly, TRB has a crisis communications product that's very good, and I think the video, once again, that LA Metro did was just outstanding. The constant communication with employees and operators, and it's interesting for people that were even contemplating using the barriers on their buses for assaults and conflict. Now those have, and many operators didn't like them, and so now those have provided an extra barrier. But many people are doing the social distancing by rear door boarding and blocking off that front part of the bus. The disinfecting protocols and products, we've got information on our website. You can go to EPA and they'll tell you which ones are certified to do SARS and coronavirus. And then certainly we've seen everybody reduce service, but have to be nimble so that you are then aligning with social distancing, FTA requirements, and the relief. I think you can go on to their website and ask them questions. That's really the best resource. And Lisa, I'll turn it back to you.
Okay. Thank you so much. A lot of helpful information there. Yesterday, DRPT offered a webinar that many people participated in and mentioned some of the CARES Act funding that was going to be available by April 3rd. Also, the $11 million that the state has already made available for emergency relief. So if you have any additional questions about that, DRPT's website may have their recorded webinar from yesterday. I also heard from Jennifer Mitchell, who I believe is on the call, that I'll offer this question in advance. There was reported this morning one of our agencies had discontinued service in Virginia. We didn't know that was coming, but they would like to know if any other transit system is considering discontinuing service or if any community is pressuring them to scale back service because of funding. So we can talk about that more when we open all the mics. So before we move into that, I just want to say that as we open the microphones, it may be a little bit chaotic, but if you can stick to some of the questions as we've laid them out here, and if you have a question, great. If you have any tips that you'd like to share with some of your colleagues about things that worked for you or some things that you discovered that maybe other people may not be aware of, please offer it up. This is a open-ended discussion, and so whatever you may have for the good of the order will be welcome. So with that, we will go ahead and move to questions and open discussion. So participants now will be unmuted.
Hey, Lisa, this is Jennifer Mitchell again, Director of DRPT. And I just wanted to, first of all, thank you for throwing that question out there. But we are very interested in hearing from any of the transit service or transit system representatives on the phone about this question of potential system-wide service shutdowns and whether there are any other Virginia systems that are currently looking at that.
Is anybody else getting pressure from their governing body or whatnot to curtail service?
Yeah, this is Scott Gross with Loudoun County. We have actually shut down all of our commuter bus service into DC. based off of ridership being down in excess of 92%. That started on March the 30th. We have reduced our Metro connection services down probably 60%, and may have to do more depending on ridership. A lot of this is because we will not be eligible for that funding that came through on the CARES Act based on it being 5307 and 5311. You had to be already in the 5307 and 5311 funds to get that funding. Since we are not and don't take federal money, it looks like we're not going to get that. So we are ones that have already shut down services, and are looking at reducing other services as we move forward.
All right.
This is Raymond from Alexandria Transit. We have not considered shutting down services, although we've been progressively downscaling services from regular to Saturday to Sunday, and we are still doing contingency planning for further scale backs. However, it is our it's understood within our leadership and within the community here that we the service we provide is an essential service, so that unless there's a extreme reason, we intend to keep, or we'll try our best to maintain service being operated, although unless there's a government mandate for services to shut down. However, the driving force behind us scaling back our services is one, promoting the message of essential travel only. We didn't want people out there riding the buses who don't need to be riding the buses. And second, we provide an avenue for our operators to kind of self-identify if they're in one of the at-risk categories as it relates to this virus. So we have been seeing a natural attrition of operators and reduction of force availability, and we anticipate that will continue to progress as time goes on. So we do anticipate at some point, it's possible we may scale back.
Did we lose Raymond?
Hi, I'm sorry, I think it muted myself. So that's it. We have contingency planning to scale back to minimum bare bones service, and then beyond that, we do have a full system shutdown in our back pockets if absolutely needed at some point.
Okay.
Hey, Lisa, this is Joe, and I'm pretty sure that Director Mitchell is getting our emails from Don here at HRT. Yesterday, we started a thing called the Essential Service Plan on Tuesday for HRT, the reduction of bus services. We've already decreased our light rail ending at 9 and ferry as well. Our ridership is well under 40%, so we're going to keep monitoring it. And Ray is offered, and the planning team also have in place where we have a lot of essential trips when it comes to hospitals and etc. He's going to be working with operations that if we have to add certain routes back in, we could find a reason to do so, we'll do so. But we have no conversation on shutting the service down completely in Hampton Roads.
It may be a conversation we have to have in the summer about messaging and restoring confidence in public transportation and try to get people back on transit. So that's something that we're keeping in mind as something we'll need to focus on some months from now. Okay, what about any other issues regarding regarding any of those points that we had mentioned earlier about? Jamie, can you put that one up there? The next slide. Anything here that Polly touched on, or that DRPT has touched on, or anything that one of the issues that's come up that we didn't talk a whole lot about was communications with your governance. Some of those, especially that have a commission operation, or having difficulty having meetings because they're not allowed to have electronic meetings, and so they can't meet, and therefore they can't make decisions about about resource allocations and whatnot. So that's one area of communications that's challenging. And then, of course, and we did touch on this about LA putting out a video to the public and whatnot. So anybody have any experiences they want to talk about with that, of challenges or things that are working for you? Okay.
And Lisa,
go ahead.
That's actually one of the reasons that we've had conversations with FTA, and what we heard from our members was one of the challenges in getting people right now. We're envisioning getting their public safety plans approved. And because many people's boards are in the situation that you described, they didn't think they'd be able to meet the July 2020 requirements. So that was some of the feedback. And as I indicated, FTA has heard from a lot of folks on that email address about the requirement, and I believe APTA will be weighing in on members' behalf. So that challenge is one that people across the country have faced.
Okay. We, in terms of cleaning products, kind of skipping around here, some of the distilleries in Virginia are converting to making cleaning products. So that's been kind of interesting that Bowman and some of them here in Richmond are making cleaning products. So I've heard that some other organizations that work with the transit industry are also providing some products. So anybody have anything to share about that, or how to access things that may have been difficult to find?
This is Bob Schneider. We got our first distillery delivery, but the counties generally have locked up all the resources. So if you haven't done it already, go through your emergency operations center.
Okay.
Lisa, this is Polly again, and one of the conversations we're hearing now is you're seeing the CDC looks like they're changing their guidance about masks. And, kind of going back to the gentleman who just spoke, transit has had difficulty accessing PPE, disinfectant. Certainly resources are going to the folks in the hospitals, and you just can't get supplies. And so I've heard from a number of for instance, police chiefs, security directors, the concern now if the guidance gets changed and people are looking for masks. We have spoken. I was on a call yesterday with DHS and have articulated how, particularly bus operators and maintenance people, out in the front lines. And of course, many of our maintenance folks are required to wear masks for specific job work they do anyway. And, would there be a pipeline to ensure that if all of a sudden there's a relaxation of the guidance about, shouldn't wear a mask and don't wear a mask, and now people are going to be looking for them, would there be transit worker prioritization? And so that's been a challenge for many jurisdictions that actually do allow their operators to wear masks or are trying to access masks. And so, you just wonder if, the quilting ladies will start, making masks for her, employees, along with the entrepreneurial distilleries that are now doing hand sanitizer.
This is Bob Schneider with OmniRide again. I've contacted a local crafter, and they are producing the fabric masks. Obviously, we're going to do the disclaimers. These aren't medical. They're optional. We're taking the approach that it achieves two things. First and foremost, it discourages touching your face, which I don't think anyone realized how many times we touch our face per second. That's one part of it. And then secondarily, we found that it enhances social distancing to see that mask on somebody. So it increases awareness. So we're not really positioning it in terms of a medical response or CDC. The challenge is the local crafter can only make so many at a time. And so we're going to be distributing, I think, 100. We've got about 120 drivers that are still reporting, like what Raymond described. We're down by about 40 different people. But so that's just some of the challenges we're facing.
I've heard in Richmond that there are different craft groups that are providing these as well. So, for all those reasons that you mentioned. Yeah.
This is Raymond. I have a question for Bob and anyone else. We're having trouble sourcing PPEs and cleaning supplies and whatnot, and I'm hearing a lot of mentions of what seems like unconventional sources, local crafters, distilleries, so on and so forth. What are some effective ways you guys have at finding out who they are and reaching out to them?
So in terms of the distilleries, I saw something on like Twitter 3 weeks ago. Just it was kind of a joke, and I reached out to the distilleries independently, and they said, you know what? Told them who I was, what our concern was, and that we were a lower priority than the health industry, et cetera. And they said, okay, cool, but we've also been hit by all the operation centers too. So it became pretty clear. So I reached out to Malarkey, KO, Filibuster, Bowman Brothers, and then a couple just others. And basically their response was, get in line. We got fire, police, everyone else. So it became pretty clear to us that we were going to have to get to communicate with the county operation systems. So we've been involved with the EOC for about a month and a half on this anyway, our emergency operations center. And so we haven't seen sanitizer in 2 or 3 weeks when we got our first delivery today. Our big issue was also communicating very loudly and very clearly that, hey, our employees are on the front lines. I know you're looking at as we're, transit, it should be essential trips, but it was just consistent communication with the emergency operations center, and that we're not asking for tons and tons and tons. We're asking for enough to refill the bottles that we had already supplied and provide that. So that's how it is in terms of the sanitizer. As far as the crafting, there was an article in the newspaper that mentioned that a local sewing shop was making them to help out with hospitals. Started poking around, asking some questions, who's doing what, and I was able to find someone who wasn't part of that because they're limiting to hospitals, et cetera. Again, we're down that food chain. So I was finding someone who said, sure, they don't really, they're doing it for a few friends of theirs who maybe have cancer or have relatives, and they said, yeah, they'd ramp up production. They have a full-time job and they're doing it in the evening. So that's,
I would put it out on social media and put out an appeal to provide an additional level of protection for your first responders, because that's what they are. And I would also contact some of the area sewing or fabric or craft shops and see if they've got guilds that are affiliated with them.
Yeah, the sewing shops, because people aren't making the dresses, they're not having their suits tailored, et cetera. So there's tons of guidance out there. This Department of Health for Minnesota has actually developed a 2-page guidance plan. There's some pros and cons, like some they want you to wash and dry, but then the dryer melts the elastic, and then but Minnesota Department of Health has some guidelines and links to different kinds of templates insofar as what the materials may or may not be, or could not be made of. I say may or may not from a legal standpoint, just from a what are some available options. So that's just what we've been able to find. Drivers are antsy. We had a service reduction. They're worried about they're going to lose pay and benefits, and like Raymond's group, we've lost about 40 employees out of 160 drivers. About 40 of them have just said, hey, we're gonna ride this out at home for right now. So we've obviously waived all attendance requirements, things like that, but we're still going to meet their economic needs because they're our employees and we love them, we care about them, and we're going to need them back real soon.
Great, thank you. That's helpful.
Hey, Bob, this is Jennifer Mitchell, and this really for anybody, but if you're also looking for sort of non-traditional places for emergency supplies, you may want to also look into maker spaces. And these are spaces where they have members that are able to make things, you know, usually they're for sale, but I know I've seen in Richmond, there's a number of them that are converting all of their operations to making things like face masks or face shields and then donating them to hospitals. And so you may want to look into that as well.
Okay, thank you so much.
Director Mitchell, can I ask a question? This is Joe Dillard. I failed to get on a DRPT call yesterday. I don't know what happened to me. Are we expecting to get apportionment tables on the 5307 funding, or by April 3rd, or you guys are just going to be dumping out that money based on the formulas that were already in place?
My understanding is that FTA is supposed to be releasing the apportionments by Friday. And we are, though, also going to be utilizing our current apportionment formulas for the governor's allocation of 5307 funds.
Gotcha.
And probably for our 5311 systems, we'll probably be using our statewide operating formula for that. So if Jen rolls on the phone, which I think she is, please feel free to correct me if I said anything wrong there.
And Jennifer, do you have that posted yet on the DRPT site, the webinar from yesterday? I didn't check.
I don't know. It should be up there, but I'll check.
Okay. So. All right. All right. What else is on your mind?
Could I ask a question? And I think it was alluded to earlier. This is Polly Henson from APTA about restoration. And so, you know, kindly it was referred to where, hey, we're taking care of our folks because we're going to need them. And so do people have plans, a detailed plan, a checkoff list for when somebody says all systems go and we can go back and leave our houses and go wherever we want? Do people have plans for restoration?
I guess that's an answer. We're just, I think, figuring out how to deal with emergency. We haven't even gotten to the restoration yet. So I think that's going to be an issue. So certainly when it comes down to late May, when we're preparing to kick into gear for June 10th or shortly thereafter. So,
and I'll let you know, I'm asking this question. I've written to TRB and to some other folks. And I've actually put a call out to the security, transit chiefs, and the emergency managers. So Lisa and Jennifer, you know, if somebody's got a great plan, you know, we'll be more than happy to share that because everybody will be looking for that eventually.
It's not just turning the switch back on. You know, it's a lot of things have happened in the intervening weeks.
Yeah, so this is Scott Gross of Loudoun County. It's interesting you ask about the plan. There's two things I've heard really interesting on this call. One is the plans to get started back up again. You know, we fully intend to just go back to running full service as quickly as possible. There are a couple of potential roadblocks to that. One is federal motor carrier regulations. When a driver has been out for 30 plus days, they have to be drug tested to be able to get their license back and start back up again. So we have concerns, is that going to overwhelm the system? You know, how quickly are we going to be able to get these drivers back up? And because our drivers are contracted, as I think most drivers are, as opposed to PRTCs, which have theirs are employees and WMATA as are employees, we're also concerned that we're going to lose a portion of these drivers because they have to go find work now. And finding drivers is already hard enough. So that's a concern of ours. We don't know if we're going to be able to get back to full speed right away, even though that's what our plan is. And then I'd like to also shift gears a little bit. I think somebody brought up earlier on this call a very good point of we're going to have a serious ad campaign to get folks back onto public transportation and allow them to realize it's safe again. It's going to take a while, I think, to recover from this, to get our passengers counts were just starting to go back in the other way, where we were starting to finally see some increases after years of decreases. So I think that is a plan that we're going to need to all think about in how can we get these folks a public education plan to get them back on the buses.
Well, and what accompanies that is the price of gas going down, and that's always been something that takes away some of our riders because it's cheap enough to drive your car now. So we've got several elements working against us, and so I think that we're going to have a strong public education, public service campaign to help people understand that this was a good thing before and it is again. So we're going to have to all focus on what we can do to get aligned on a message that works. Maybe some of our advertising associates, our members who work in that field, can help us with that. Okay. Anything else on anybody's mind?
Hey, Lisa,
yeah.
If I may, this is Catherine Carlson with Pulsar Advertising. Appreciate the shout out. I think you're right. A lot of systems are going to have to establish a communication channel, not just now, but when service resumes. One of the things that we have been thinking about and talking about internally is there an opportunity to convert unused employees and system equipment now to help with some of the emergency support, like delivering groceries, delivering emergency personnel to various appointments, et cetera. Has that been discussed by any of the areas? Just curious.
Not that I'm aware of. Maybe there's something going on out there that somebody can share.
Yeah, this is Raymond. We stay active in our local city government here, so we have periodically gotten requests for assisting with transporting hospital workers, relocating families from shelters to alternate residences, and we've been in touch with them about if there's any way we can contribute our dormant resources to help with either food distribution or providing accessibility to food or groceries or things like that. So we're keeping our ears open. We haven't really found anything substantial or routine or consistent, but we are open and eager to help out in our community in any way that we can.
We'd be happy to share some of those stories in our weekly clips. If anybody, we can make a section for that. If anybody has some good things to share, and make that something that we feature each week. So if you're doing something like that, let us highlight it.
Hey, Lisa, it's Jen DeBrule. I just wanted to share that we have heard from a couple of the rural agencies out in Southwest Virginia that they are working with some of their community agencies to deliver groceries. Instead of taking people out to the grocery store, helping make those grocery deliveries. So some of that is just naturally starting to happen around the Commonwealth.
Okay, I think that'll go a long way to show that we were there for the community, and then it would make it easier for the community to consider transit again when it becomes possible. An essential component of what makes your town or your county a good place in which to live. Okay, well, it looks like people have raised some good questions, and I'm sure some more will continue. So as Polly mentioned, she's happy to answer some questions. If you have anything the VTA or DRPT can help us with, we all want to help you out in your agencies, because it's a very challenging time, and we know that you're trying to keep your staff together and provide the services with the resources that you have, and so we applaud you for that. So we too have had to adjust our annual conference, which had been scheduled for late May, is now pushed back to July 8th and 9th. We hope that we'll be back in operation by then, because it's difficult to reschedule. If we hadn't made the July date work, we were all the way to Christmas before we could have our conference. So everybody keep your fingers crossed for that. We will be sending out more information about that with rooms and whatnot, but pretty much it's just picked up the conference and moved it a few weeks farther out to same place, Roanoke, Virginia. So we hope you'll all plan to come. So if there's nothing else to raise at this point, we will conclude today's webinar. So thanks everybody again for joining, and let us hear from you.
And Lisa,
thank
you for letting me join you today.
You were invaluable. Thank you, Polly. Okay, talk to you guys soon.